With me today on the show is Loretta Werth. Wanted to talk about people with head injuries today because you can't see it, so it's hard to know who is and who isn't. And my understanding is that head injuries, serious head injuries, are a whole lot more common than most people realize.
That's true. If you start looking on the streets, you probably find that a lot of homeless people have head injuries that have them so confused that they don't know what to do. Consequently, they'll turn to drugs a lot easier and alcohol a lot easier than somebody who doesn't have a head injury. Also, people in the penitentiary system, a lot of them have head injuries because one of the manifestations of having a head injury is the hostility that just comes out of nowhere and you don't know where it's coming from and you're just angry and you take it out on people and things.
When we were talking the other day, you said, this is perhaps jumping ahead, but we can come back and forth, I guess, in our discussion. When we were talking the other day, you said some of the hostility has to do with an anger over the losses. That suddenly you used to be one person, suddenly you're another person, and it's hard to accept the change.
It really is. It's very difficult. In my own case, I was a mover and a shaker and a fairly attractive person. I had people in Hollywood whistling at me, so that means something. But I used my looks and my job and my abilities to do things. And now I find I don't have these abilities anymore, nor do I have the looks anymore. I can't even walk straight. So it's a big change. It's like being put in somebody else's body all of a sudden. So you get confused, you think you're doing one thing and you turn around and that's not the real situation anymore. It's not reality. You're still living in the past. And that tends to make some people not only confused but very angry.
So a point I often come back to is the need for each of us to really be honest with ourselves about who we are and about the world we live in. But if you can't even be sure of your perceptions,
the only thing you know,
how do you be honest?
The only thing you know for sure when you have a head injury is that you're going to be more accentuated on your characteristics than you used to be. So if you were a snot before, you're going to be twice a snot now. So if you were really nice before, you'd probably be still nice. But the people that had temper tantrums before and were childish in nature and selfish individuals, they're twice as selfish, they're twice as poutish, and they go through a phase that they have to recognize this because you can't continue to be that way. It just doesn't fit into society. And their behavior keeps them from achieving things that they necessarily have to have, like doctor relationships, lawyer relationships, other people to talk to, just outlets for socialization. It's really important.
One way of putting it might be that before the head injury, it's sometimes a little easier to deal with all the complexities, all the social complexities we come up with for hiding and smoothing over all the unpleasant quirks of humanity. You know, and with the head injury, if I understand you correctly, you get a real clear picture of what's really there.
Well, not necessarily. Some people don't, and they have a lot of problems. There's a guy that called me this last week, recommended to me by a friend of mine, a family member of his, and this person has had a head injury, been diagnosed with a serious head injury for 8 years. He goes out every day, he tries to work, he's trying to raise his daughter, and he just is so frustrated because something's wrong. He can't do it, and he doesn't understand why. Everybody in the outside world says, well, just try, keep trying, and try a little harder. With a head injury, that doesn't work. The harder you try, the more frustrated you get. You have to get everything into a knowing circumstance, so you have to know yourself. And the better you know yourself, the better equipped you become to take care of the things in the world instead of becoming frustrated with them. You set your priorities better. You set your times better. Even your watch, like mine, I have minute, 3-minute, 5-minute, 10-minute, 15-minute, 20-minute, 25-minute, and 30-minute alarms, plus hourly alarms.
Goodness.
To
I
keep
didn't know
me
they made
all
them like that.
going so that I know what's, when I forget what I'm doing, that it wakes me up and I can then concentrate hard to try and remember what I was doing. But I feel sorry for this guy because he's very frustrated. He has a lot of anger in him. His family is complaining about the anger, and yet he doesn't think anything's wrong with him. He thinks it's everybody else. So it's the same thing as a psychological problem, except that it's caused by a head injury. There is a physical reason for it to be that way.
So,
Well,
in one sense, I guess I'd like to say, isn't there some way eventually, somehow, to get past the anger? But if it's caused by a physiological condition rather than an emotional condition?
well, there are ways to deal with anger, and they're all learned. It's kind of what we do with our society. We learn different techniques of manipulation, different techniques of survival and dealing with our society. And when you have a head injury, you concentrate more on the ways to achieve those little successes with known ways of doing it. So for instance, if you have a lot of anger, you are concentrating on what makes you angry. Then you take and you internalize the answers and you look at them again with help from a counselor, and the counselor points out that perhaps you might try this, and then through experimentation and a lot of trial and error and all your people around you helping you, you can eventually learn not to be reactive. And you learn new
That's
technology.
something really everyone needs to learn.
Oh yeah, but
Because so many of us are just reacting to everything and never taking the time to act in the way we believe we should act.
yeah. With a head injury, for instance, if there's noise in the background, it could be so distracting that the person actually starts holding their head and becoming so annoyed that they'll just go off and come unglued at any little thing that goes on. So they really need to know what's causing it.
Was that what you called overstimulation?
Overstimulation is terrible. Just get excited, get overstimulated, you fall apart. It's terrible. I get overstimulated doing work here at the station, and I do videos, training videos for the Colorado Head Injury Foundation. And I'll put in so much energy into it that by the time 2 days have gone by, I'm so exhausted, all I can do is just sleep. And it's because I'm overstimulated, I'm excited, and I'm working so hard at doing everything right that if I keep on that path, I won't be able to do anything. You just literally fold up.
So you have to pace yourself a little more?
Pace yourself a good deal more and prioritize what becomes important. I let my crews handle a good many decisions, but I instruct them beforehand exactly how to do what I want done, and then I say, go do it. And then I just back off. Then I take care of the editing because that way I can pick up the pieces. But I can't be there every second because I might not even remember what I'm talking about from one minute to the next. So
that would be frustrating.
I've learned a few control measures like that. There's several different kinds of head injuries. There's traumatic brain injury, which comes from like a car accident, gunshot wound, being hit on the head, being shaken severely like they do some infants.
Which that one I guess would be especially invisible because you really don't see there's nothing to show that it happened.
Well, and the child is so small that you don't know their intelligence, ability. A lot of them don't speak before they're shaken and rattled. And their little brain just sloshes against one wall right to the next wall. And
Inside
back
the
and
skull.
forth, and it gets so bruised that the poor little deers, and they lose brain cells with this happening. And they're too young to talk sometimes, so you don't know that they're brain injured because they don't start talking until they're 18 months old, when they should have started a lot younger. Then all of a sudden they've got this retarded stigma where they're not retarded at all. And there's a big deal of difference between retardation, mental illness, brain injury. And there are 3 different types of brain injury. So that's one.
How would you separate those terms?
Those ones I just said?
Yeah.
Okay, mental retardation is a genetic defect that is medically caused, and it's a birth defect, and that's one of the forms of head injury, a birth defect, a hereditary problem. The mental illness can be acquired, or it can be hereditary, or it can be brought on traumatically. So mental illness kind of covers all 3 areas, but it's unto itself different in that it doesn't have some of the same physical problems that you have with the hereditary or the traumatic brain injury. And then the traumatic brain injury, of course, is basically related to something that happens after you're born, anywhere from lack of oxygen to a gunshot wound.
Lack of oxygen could be, being knocked out for too long or something.
Drowning a lot of times causes lack of oxygen. In surgery, where a person is under anesthetic and is not revived soon enough, lack of oxygen. Smothering. There's several different types of lack of oxygen type things. Brain tumors, there's another one. It's very, very difficult to all of a sudden wake up and find yourself one of these people, especially.
But it brings I'm sorry, you were going to say?
Well, everybody has their own prejudice, okay? And I don't care what people say, they do. And mine has always been that I was so smart, okay, that I could deal with physical handicaps but not mental handicaps. How just the world is. Yes, I love it. I really do.
Is this something for the idea of karma?
I think so. I think it's beautiful. Because I'm learning very slowly. I still have the same prejudice, but I'm learning now to deal with this problem. But you'll notice I even separate it from myself still. I still separate it.
It's a prejudice, it's not necessarily your prejudice, you mean?
It is my prejudice, definitely, which is really strange.
But you say you separate it from yourself in what sense?
Well, I'm not retarded. I'm brain injured.
Okay.
That's a form of separation. It's legitimate, but at the same time, I'm the first one to point that out. Okay? So it's like I can't be ashamed of myself, and yet at the same time, because they're retarded, why should they be ashamed of themselves? Yeah. See, there's all these different ways of tackling something with yourself.
Yeah. It's a whole different subject, but on a similar note, I guess, when I first thought about becoming Sister Who, using female pronouns in reference to myself, and part of me just went, oh, ooh, and then this little question popped up in my back of my head that just said, why? Is there something wrong with being a woman?
Really?
And I was like, oh, I don't want to answer that. But that was a bridge for me to cross, and I did not think of myself as having any kind of prejudice on that subject. But to look in the mirror and say, what if I had been born a woman? Would it be every bit as good as the fact that I was born a man? And if I couldn't say yes right away, I think it means there's something I need to work on. Well, in a similar sense, to look at a retarded person,
right,
and say, if that was me, I need to understand that it would not be any more bad.
Well, this has to do with socialization a lot. The people around us and how they react to the world that we live in and the way we're taught.
Which is the kind of two-edged sword of the brain injury that I was thinking about before as we were talking, that there's a personal side to it, but there's also the public side to it.
Yeah, and you have to be really strong to separate yourself from the way the world looks and the way you know it should be, and react to it the way it should be. You have to really draw from inner strength in order to do that, because your friends, your family, things you hear on TV just don't reflect those realisms. They're pretty negative in a lot of aspects.
It reminds me of a minister I heard a number of years ago. He used the phrase status quo, and someone said, "What's status quo?" And he said, "That's Greek for the mess we's in." But in any case, yeah, there's so much that's handed down, you know, attitudes toward women, attitudes toward people with different abilities or disabilities, that we're not even aware we're practicing.
Yeah. When I was in this car accident, the first thing that happened to me, I was lucky. A woman in the ICU unit where I was unconscious for 3.5 weeks bathed my face with water many, many times a day, because the scars are there but nobody can see them except me, because the rest of them would be really bad scars if she hadn't done that, because they did not stitch my face.
Oh my.
The doctors did not stitch any of my scars. Across my knees, great big huge thick scars. Part of this is socialization again. I had doctors that were from another culture, and women are not prized in that culture that they came from. So since I was all messed up and they thought I was going to die, they had very little to do with me. This is very difficult for me right now. I'm still going through this, trying to comprehend how anybody could give up on my life. I know there's a lot of people out there, there's Kevorkian and a whole bunch of people who want the right to die, but at the same time, I want the right to live.
Yeah.
And if I am living as a vegetable in a bed with my brain still intact in some form where I can be of use to society, I want society to want me. And maybe that's not exactly the most economical, but I still want it.
Well, I think we need to understand that there is value in every life. At the same time, I guess what I understood from Dr. Kevorkian, since you mentioned him, was that for the person who doesn't want to,
that's exactly it.
They need to be able to choose that.
Yeah, but the thing that really worries me, like right now with the health care plan that's going on, they're taking and they're saying brain injured individuals are kind of a negative, and that they don't need to be considered because you're either going to make it or you're not. There's a lady.
Every person needs to be considered because every person is valuable.
There's a lady right now that won a court case where her husband will be disconnected from his life tube survival through his stomach because he has a brain injury and he has physical injuries. And they don't know enough about brain injury right now to know how far this man is going to recover. This man seems aware, but he cannot talk. It's like when I woke up, I was talking to people, made sense to me, but it didn't make sense to anybody else. Now, if they had disconnected me, I wouldn't be sitting here talking today making sense. This man doesn't have a prayer. He's been disconnected. He's going to die. Because she won this court case so that she can get his estate, and it will not be wheedled away on medical care. And God bless her, but she doesn't know.
I just don't think it's someone else's choice.
Well,
in one sense, I understand if the person can't say anything, how do you determine?
Yeah.
You know, but at the same time, I guess that's where more and more we're hearing about the need to set up these legal documents in advance. You know, that if such and such happens, this is what I want done.
The only thing I would like to say, you know, I give people 100% to do whatever they want with their life. But I don't want them to jeopardize mine in the cause of it. So that any doctor out there, I want him to investigate before he makes the decision according to what he's told. Because he should be sure that's what that person would really want. And when they've got a
Was
brain
it,
injury, they still should try to communicate with them.
Yeah. Well, and it forms a very plausible but very difficult scenario, I think, to think of someone. I mean, when you're laying in there in bed with your eyes closed and you're not asleep, you can hear sounds. Maybe you can open your eyes and even look around if you want. Until you open your mouth, nobody else in the room knows what you're thinking.
Yeah.
If it just this interesting scenario that I'm trying to comprehend, what would you do, for heaven's sakes? You're in a body, you can see, you can hear, but you can't move your tongue, and you can't move any of your limbs. How do you signal people? How do you let them know what in the world is going on, other than, I don't know, if by chance you can twitch your eyes back and forth, but if you don't even have eye movement, but you have a conscious mind, what do you do? It forms very
There's something
strange
that
kind of prison.
I found out. When I was 12 years old, I made a vow with God, the God that I believe in, that I would never do anything to end my life. I would allow Him to take care of me totally, as long as He made a promise to me, which was that I would never suffer more than I could stand. Well, as it turns out, God has made this promise to every living human being on the face of this earth. We have a wonderful mechanism in our brain that will turn off all pain, all awareness, when we get to a point where we can no longer stand anymore.
Without killing the person
without killing the person. So He kept His promise to me, and then I find out, oh no.
You find out?
The other point.
God's promise to you about not being in more pain than you can stand, and then finding out about the thing in your brain.
And one more sentence back where we were talking before that.
Being in a body and not being able to communicate.
Okay, yeah, that's it. When your time comes, when you're going to die, all the circumstances around you will happen. And there's nothing you can do to prevent that when it's your turn. But if you're laying there as a vegetable and it's not your turn to die, you will communicate.
No matter how
If
paralyzed?
it's not your turn, it's not your turn. So regardless of what happens, and that's a thing that where trust really comes heavy, because that you really have to learn to trust that deeply. But it's absolutely true. Absolutely true, I feel in my heart.
If it's not their time and someone decides this person should be let go, suddenly that person will be able to speak or do something that stops the process?
Or God will help you live through this, because in my own case, I was unconscious.
Well, the one that springs to my mind, I guess, is the much reported case of Karen Ann Quinlan.
Quinlan, yes.
Yeah, and they kept saying take her off, and
when they took her off, she still lived.
She didn't die. But goodness, there's so much more to say on this subject. You had mentioned that grief issues are real important as well, but do you have a phone number for us, quick, before we
The
run out of
Colorado
time here?
Head Injury Foundation is willing to answer questions and to help people with head injury or suspected head injury. 730-7112.
And we'll put that in the end credits as well.
Okay, thank you.
Goodness. Well, we've only got a couple minutes left. The couple points when we were talking earlier that I especially want to include here. One was when you see someone, regardless of what type of disability it is, I think there's a natural inclination to run in and fix things for people. And we were talking about that and how it needs to be much more, recognizing that a person is a person is a person, regardless of ability, handicap, whatever. You show respect by asking them.
Yes.
And you don't just ask them whether, but you ask them how.
How?
So you don't superimpose your own way of answering the situation onto them.
Our system tends to tell us how we should be helped. If you're poor, you need food stamps, you do this, you do this, you do this. if they ask people how they should be helped, 90% of the time you would get a clear, concise answer, and the help would be more value to people. And if you let people who are handicapped respond, then they also feel like they're part of society and that their value
I guess
is...
it comes down to respecting the other individual as being an individual, and
regardless of
learning-
how bad off they are.
yeah, and learning to communicate in other ways.
Yes.
You know, rather than insisting on a particular type of communication.
Right.
So, goodness. The other thing you mentioned, just to include briefly, was that for each of us to be aware of where the responsibilities lie. That no one is responsible to read our minds.
That's
that we need
true.
to stand up and be ourselves at the same time. In one sense, we need to reach out to others and let them speak to us. At the same time, we need to find our voice and say the things we believe in too.
That's right. Without anger and hostility, we need to tell
Without anger
people
and hostility.
exactly where we stand so that we don't leave them to jump to conclusions on their own.
But also without apology,
Yeah.
so that we don't encourage them to patronize us. But
Right.
this has been a wonderful conversation.
Thanks.
Thank you so much for coming. Hope
Thank
maybe we
you
can do
very
it again
much.
sometime.